Yeah, this is Whiskey Bravo 5 Delta, the Medical Amateur Radio Council, brand rounds on the internet, a group of amateur radio operators that are either in healthcare fields or have an intense interest in healthcare related fields. And today we're talking about peptides and therapeutics in medicine, or otherwise coined by me today as peptide mania, because it's really on the upswing and it's being used in many different ways by the public in different ways and by physicians in many cases. I'm the moderator today, Jay Garlitz, DMD, call sign is AA4FL. And we're going to be looking at everything from discovery to clinical impact, market trends, innovations, and future outlook. And one aspect of today's discussion, as we prompt and roundtable here, is the background information. Keith, I've got M3IM with us here to check in. The background information was so as a start for the presentation was generated using AI. In this particular case, it was generated using Copilot's assistance and PowerPoint, and it's been gone through and been modified and put research in. And I think you'll find it interesting. So Peptide Mania and a roundtable discussion, note that the comments made here by individuals, and it's certainly not the opinion of Marco Limited or Healthcare Hands. It's not a form of diagnosis or treatment suggestions. So if you have questions that are that related to your personal medical situation, discuss the subject with your healthcare providers, but hopefully the discussion today will give you a little bit of knowledge and background as you discuss that with your own healthcare team. So according to Copilot, if you go on Copilot and do a search, peptides are short chains of amino acids that act as essential biological messengers and building blocks in the body. And the definition of structure, according to the Copilot search, things short chains of amino acids are linked by peptide bonds, typically containing 2 to 50 amino acids. And whereas longer chains, when they get over that, are classified as proteins. So each amino acid has an amino group, carboxyl group, a side chain. It's the sequence of amino acids determining the peptide structure and function. They can be straight, linear, they can be cyclic, but their small size allows them to interact with specific receptors and penetrate tissues more easily than larger proteins. So medical science, recognizing this, has started to apply this in therapeutics and treatment. And we'll be talking a little bit about that today because they do have biological roles in nature. Peptides serve as signaling molecules, hormones, neurotransmitters, and growth factors. And they regulate a wide range of physiological processes, including hormone regulation. So insulin, and of course that's a peptide that's been used for many years. Glucagon, growth hormone releasing peptides controlling metabolism and blood sugar levels. What about immune function? What about antimicrobial peptides that help fight bacteria, funguses, and viruses, or fungi and viruses? And neurological signaling, neuropeptides, things like endorphins and substance P that influence pain, mood, and appetite, and even tissue repair and skin health. There's collagen peptides to support collagen production, wound healing, and elasticity, skin elasticity. So from that list, as described from 3 different sources, and Copilot lists their sources, and there's some diagrams as well as what these peptides look like. Knowing that, you can see how it could be applied into medical treatments. What about sources? Where do these peptides come from? Certainly, they can be endogenous, produced naturally in the body. They can be food-derived, released during digestion from proteins of meat, fish, eggs, soy, and dairy. They can be synthetic, created in a laboratory for research or therapeutic purposes. And synthetic peptides are used in medicine, research, skincare, often designed to mimic the natural peptides or target specific biological pathways. And they picked that from Wikipedia and 2 other sources. I'm going to pause one here for anyone else that would like to check in on 20 meters. Make your call to Whiskey Bravo 5 Delta. Okay, no further check-ins at this time. I'm going to talk a little bit more about this background information from Copilot, and any of you can go in and search for, the peptides, bring up this information. You might use a different AI application. The peptides have been developed as medications and research tools due to their high specificity and low toxicity. So examples include insulin, as we mentioned, for diabetes management, things like GLP-1, um, GLP-1 receptor agonists like semaglutide for type 2 diabetes and obesity, peptide-based cancer therapies that target tumor cells directly, cosmetic properties, cosmetic peptides in skincare to improve collagen production and reduce wrinkles. They're also being studied in regenerative medicine, neurobiology, antimicrobial therapies, because their small size allows for precise targeting for clinical receptors. Now, when they get larger chains, because peptides are also similar to proteins, they're both made of amino acids, but the peptides are shorter and often act as signaling molecules, whereas the proteins are longer, fold into complex 3D structures, and perform structural enzymatic roles. Peptides are easier for the body to absorb, can be synthesized or modified for specific purposes. So that being said, do we have some comments that anyone would like to make about peptides for the group here on Zoom, so we can let our group on 20 meters hear that audio? If so, go ahead and let me know. There'll be plenty more opportunity to give input. If you're listening on 20 meters here, realize that the slides and the background information, the prompts that people can see on Zoom, are available to you to look at while we're doing the discussion here, the roundtable discussion on 20 meters. So just go to healthcarehams.org, scroll down on that entry page, the right-hand column to where it says posts, and you'll see the interactive PDF slides of today's background information. We'll be able to bring those up and review the links, the actual foundation points. So our peptide's natural. So just using AI as a guide. And by the way, on 20 meters, signals are going to be poor today for propagation purposes. We're also using an OCF antenna today, not our usual antenna. So please excuse that. But peptides are natural, and one of the reasons for asking the question isn't just to find out if peptides are natural, but if you search for that in this particular search engine, it came back with 12,200 results. So you can imagine the public trying to search and answer questions, how confusing it might be. Thus, the Medical Image Radio Council, having the grandmans in the air, we have the ability to talk about this in a roundtable fashion and focus a little bit better on what's going on here. And, well, cut through some of it as well. Excuse me. I understand the band has been pretty difficult today, away from 20 meters. Thank you. People are sending me notes in real time chatting. But peptides are natural, being short chains of amino acids. What does it mean, natural? Not necessarily only natural in the body, but in various foods, because we come in through dietary sources. But like crucial roles, biological processes, sort of sums up what we were just discussing. Things like hormone production, immune response, they can be derived from living sources like plants, animals, and microorganisms. Where some peptides are synthesized in labs, many are found in nature and are essential for overall health. And that's the rub here. What's essential for overall health, and what are the ramifications of taking something that either comes naturally or through the food and applying them in different fashions as therapeutics? Who monitors that? Is it strictly monitored? Is it limited since it comes in by food? If you don't call it a drug, can it be offered over the special niche groups? And we do have an attorney on with us today, and I commented some of this today on 4JL is with us. And these are discussions that we'll have through. So from the AI generated information, what are the therapeutic peptides? As we talked about, the short amino acid chains are 2 to 50, and the molecular weights are very small. They bridge the gap between small molecules and large biologics, offering programmable architectures with high specificity and lower toxicity. We talked about some of the key functions already. One thing we may have not mentioned already is the possibility of anti-cancer targeting therapies. And there are 80 plus FDA approved peptide drugs as of the research. It may or may not be the true amount. Again, this is AI generated, but according to the results, there's 200 plus peptides in clinical trials right now. Now, the first peptide drug was insulin. That's 1922. So we're not necessarily talking about a new subject. It's a 100-year-old plus subject, but we're talking about it in such a way that we expect a lot of growth. And the reason why, if you look at the market landscape, you'll see, I'm going to pause for a second for ID. This is Whiskey Bravo 5 Delta, transmitting from Hawthorne, Florida, AA4FL at the microphone. The Grand Rounds in the Internet, open to all amateur radio operators operating on 14.342 megahertz today. And looking at the market landscape from what's been generated, it's currently approximately $141 billion market size global-wide. This in 2025. But projected by 2033, $295 billion. The market share, the largest regional market, according to the statistics, called was 62% in North America. What I found interesting, they had a chart about market share by therapeutic area. We just talked about oncology as being something we thought to be fairly new, but it's according to this, 35% of the market share is in the oncology. So we're going to pause for a second here. Stuart, do you have anything to comment on that WA9ZPL about peptides and oncologic use?
Well, I think you need to make a distinction between naturally occurring and synthetic peptides.
Okay, so please do make that distinction. And if you're aware of the differentiation there and what's in the marketplace, please, for oncology, please comment.
Well, for example, insulin is naturally occurring, and anti-cancer peptides are products of the drug factory.
Okay, so the therapeutics are this is AA4FL, the Whiskey Bravo 5 Delta. You're saying that the peptides that are generated synthetically are taking into account that they're receptors in the body that they can target for therapeutic use, but because of the fact they're peptides, they can find these receptors. Is that the goal? Is that what's occurring?
Sometimes, yes, exactly. Also, there can be peptides that are in your food, or peptides that are inhaled, or peptides that are produced by the bacteria in your gut.
Okay, thank you, Stuart. I also have Dave with us, KN2M. Dave, can you think of any peptides that are being applied for ophthalmologic use? KN2M, AA4 Alpha Mike, Whiskey Bravo 5 Delta.
Yeah, hi, Jay. Thanks. There was a recent article published in Ophthalmology Retina that looked at the possible protective effects of GLP-1 peptides and development of neovascular age-related macular degeneration. And they did find a possible relationship, a protective one. And it was a 3-year study. And as the study went on, there was a little more positive effects for protection. But the authors state several weaknesses of the study, and certainly it's going to be looked at in the future. But they're not sure at this point if this is a protective thing that looks at the non-neovascular age-related macular degeneration, and that's a protective effect, or it's some other vascular type of arrangement. In any event, it's going to be looked at again. And the issue is, of course, is that neovascular glaucoma, patients with both neovascular glaucoma and diabetes, both conditions are somewhat rare. It's somewhat socioeconomically driven. And we'll see what the studies look for in the future. But anyway, I thought it was a very interesting project to do. It's been ongoing now for 3 years. Back to you, Jay. This is KN2M.
Okay, thank you, KN2M Dave up in Buffalo. Appreciate that input. I'm going to be calling on Andy and Mike here, N4JEL and WJB momentarily. But before I do, I just want to shift gears a little bit. As we looked, I had mentioned the chart being 35% oncological application. It also had muscle recovery at 24%, cardiovascular at 14%, infectious at 10%. Then it listed others at 17%. So we've all heard and we've all seen medications all over the internet about a GLP-1 and from your doctors too. So as we move over to that subject material, and I call on the two other individuals to explain or certainly contextualize this, the GLP-1 marketplace in 2025 for weight loss, obesity, some even planned cardiovascular improvements, 66.4 billion. But by 2032, we're talking 185 billion. And of course, you see these ads on TV all the time. Some of the brand names, Ozempic, Wegovy, Mounjaro, Zepbound, being the dominant drivers, with applications expanding beyond diabetes and cardiovascular and kidney disease. And my physician had mentioned that to me, suggested to go on that. So I want to ask Andy a question as somebody that was in private practice, and knowing that a lot of physicians are having the discussion with their patients, Andy, and they're foregoing maybe some of the traditional discussions about losing weight and kind of leaning into the GLP-1s solving the issues, and I don't know how much involvement they're merging with traditional weight loss approaches or just counting on the drugs. What was your approach, Andy, when you were in private practice? You had somebody that was very heavy, was a diabetic. How did that discussion go? WJB, Whiskey Bravo 5 Delta, turning the mic over to you.
Okay. Of course, I've been retired since 2018. The GLP-1s were available, but they weren't approved for weight loss or anything like that at that point. There were definitely doctors prescribing them for that purpose off-label. Since then, they have been approved for weight loss, and lots of people have used them. There is data available stating that it does have cardiovascular and possible renal protective functions to those peptides as well, which of course is good overall. My practice had a fair number of people who were on the low socioeconomic scale, so it would be an issue if I was still practicing today for those people to obtain these medicines. Because unless they've got insurance that covers it, the cash price is, well beyond what they would be able to afford. So that's a socioeconomic thing that goes along with these drugs. Now, of course, later on, if the drugs have been out long enough, they may become available in generic form. Or if the government gets involved and starts supplementing the expense of the medication in the hopes of reducing expensive expenses related to having heart attacks, strokes, etc. by using the drugs, and perhaps that would change. So, but there are some people who can't take them. Those who have pancreatic disease are excluded. You know, because it can cause pancreatitis and occasionally gallstone flare-ups as well. So, back to you, Jay.
Okay, thank you, WJB Whiskey Bravo 5 Delta. Yeah, that's interesting too, because that discussion that we're having, you just mentioned it's the side effects, and we'll cover side effects as well. And what about patients that have kidney disease, and they're suggesting these to people that already have kidney function issues, and what if they start to run dry and it affects their kidneys? There's all types of discussions. Mike is with us, N4JL. Now, Mike, if I remember correctly, you're involved. You're an attorney, but you do retired attorney, but you do patient simulations at the FSU Medical School. So, as you're doing your patient simulations with medical students, being that this is the forefront right now of medicine, have you run into the situation where they talk about these types of issues of weight control and the effect on general health, and do they suggest these peptides for use? I'm turning the mic over to N4JE. I'll go ahead.
Oh, good morning, Jay and Annette. No, we haven't had any discussion at all about peptides, which is kind of interesting in a way, but um, in the simulation with the first and the second year medical students, the definition of peptides is kind of indefinite to the average person and probably sometimes to the FDA. If I can shift my comments a little bit in that direction, to my knowledge, the distribution of peptides is being regulated by the FDA as any other therapeutic chemical. So some obviously are going to require testing, clinical trials, et cetera. And I'm not sure where they're drawing that line. Perhaps some of our other participants might have some idea on that. But the best I can say is current regulation is like any other chemical distributed for therapeutic uses. In another aspect, I am an old gym rat. And so I hang around a lot of old power lifters who've lived through the anabolic steroid generation. And peptides are being heavily marketed to those people who are interested in fitness and longevity. The best advice among the old guys is to treat them like anabolic steroids and don't touch them. This is N4JEL.
Thank you very much, Mike. N4JEL. Yeah, I think that off-label use is an issue. It's one thing to have them approved. It's another thing how people use them, I suppose, and would be liable for pushing that off-label use. We had a couple of comments that came in through chat. Jack's with us, a periodontal researcher. Jack, I'm not sure if you're currently still doing research. It's just you're retired from that very important career, and I know you've had your hand on a lot of different research. Would you like to comment on some of what you know about peptides in the oral environment? I'm going to turn the mic over to KD4IZ. If you would unmute, Jack, go ahead.
Okay, I'm going to do this mostly in Zoom, Jay, and it's going to be very quick. A comment about the regulatory environment there. These are biologics, and that's how they're regulated. It's very similar to the drug path. However, you can have various sources of biologics, anything from synthetic to cell-derived, and there actually are cellular constructs that provide these peptides, growth peptides or signaling peptides, that are used in oral regeneration and in other fields. So it's not as clear a cut thing as one would find in a pure drug or pure device environment. I was involved with research and the actual approval and distribution for a short period of time of a cellular construct that's whole mode of action was providing growth signaling factors, most of whom were small peptides, that would trigger healing when you had stalled healing or poor healing situations. I'm going to leave it at that. I posted a fairly recent review. It's okay. There's some little issues with it that I have, but I think it's a good read because they do a very good job of where in the oral environment and in oral surgery, dental surgery, that is repair of teeth and pulp, repair of bone or regeneration of bone, those are being applied or researched. And so it's a good read. It overlaps a lot with the effects of the peptides on other parts of the body. And so it's kind of an ancillary piece of information, but I thought it might be interesting to some folks here. That's all I got here, Jay.
Okay, thank you. KD4 Ozat, Whiskey Bravo 5 Delta. The name of that article is Bioactive Synthetic Peptides for Oral Tissue Regeneration. It's a April 2021. So if you want to look that particular article up, you'll be able to find that and read it. We also is in Frontiers, it looks like, the journal. Thank you, Jack, for sharing that. We have M3IM with us. Keith had also mentioned a medication that's being used for osteoporosis. Keith, would you like to unmute and talk about that a little bit? M3IM, are you available, Keith? Whiskey Bravo 5 Delta.
Yeah, I'm here. I can only tell you what I know from what I've been told. Forteza, or there's several other names for it that are, I guess, generic. But peptide is a medication given by subcutaneous injection once a day, and the maximum time use is 2 years, and it's been shown to stimulate osteoclast formation in the bones and increase the calcium so that you can do some bone repair from osteoporosis with this. It's been shown in men and women to be effective. That's about what I know about it right now.
Thank you, M3AM, Whiskey Bravo 5 Delta. For ID purposes, this is Whiskey Bravo 5 Delta, AA4 Feltamite transmissions from Hawthorne, Florida. It's our Grand Rounds Leonette. It takes place every weekend, every Sunday on this frequency at this time. We appreciate the amateurs that allow us the clear use of the frequency and hope you find this interesting. Everything that we're talking about, the background information, the video prompts that we're using on Zoom with the Zoom simulcast. For those of you on 20 meters, go to healthcarehams.org and scroll down the right column to the post section, and it will be the top list of the post section. You'll be able to bring up the slides and the links, etc. And going through the internet and AI and looking at some of the marketplace penetration of GLP-1 and talking about off-label use, I had just come back from a funeral in Boca Raton, Florida. So Boca Raton would be like the Beverly Hills and maybe Palm Beach where President Trump is, but very close by in the same county. And of course, you get a lot of people. You can find somebody using off-label use. It's probably going to be there. It's a lot of plastic surgery in that area. So I did a search for marketplace penetration, got 9,400 results, and as you get instead of marketplace penetration, just basically get advertisements. But one of the top returns was the best microdosing GLP-1, no insurance needed, weight loss injections made simple, compare prices, and it's the microdosing that came up. And so people using small dosing, and it brought to mind homeopathic medicine. I mean, how do we microdose? How do we determine what dose to use? Do we really have that? Is that a marketing approach? You hear it on TV and some of the advertisements, and certainly, and I'm not sure it's on the public airwaves or on some of the ones that are app-based. But I don't know what the microdose would be. I know the medications was just mentioned could be extremely expensive. Andy mentioned that in private practice, patients that can't afford it would have a very difficult time. And I don't necessarily think that's the only reason why it's applied. And I don't think it's the homeopathic approach where they're diluting it to have a trace amount and getting a desired action. But still, it's perhaps an off-label use. I don't know. I don't know if it's off-label to do it that way or not. But again, it's just an observation. And that is an area I just mentioned of very wealthy people. So I don't think money was the primary. I think the microdosing down there was people that don't have medical issues. They don't have diabetes. They don't have extreme obesity. And they want to lose 5 to 10 pounds. And they want to look beautiful, just like getting plastic surgery to their already beautiful body. Just another way that it could be used, or you might consider that to be misused. CNN Online had an article that caught my interest. It's called The Wild West of Peptides, and that it's booming, what's real, what's risky, and what's not. So you have to be a subscriber, but if you are, CNN.com, look for peptides, what to know in wellness, and they go into all these different details. And that's what actually caught my eye and brought this up as a subject. So another thing that just came up, I don't remember the source, but it'll be next week's discussion, was psychedelics. There was a report that President Trump is we're going to be convening a discussion towards allowing research for psychedelics for medical purposes. And that we'll talk about that next week. So I think you'll find that one interesting. Those of you that have taken psychedelics in the 1960s, you don't have to admit it, but let's talk about the future and not the past, unless you're having a relapse from the 1960s. But the FDA is considering easing the restrictions of peptides because RFK Jr. calls himself a big fan, according to CBS News, and whether or not that's fake news or not, I don't know, but they're holding a meeting apparently this summer. The article was April 15th, 2026, this summer, to consider easing restrictions. More than a half dozen peptide injections for a group of unapproved therapies that become popular among wellness influencers, fitness gurus, and celebrities, similar to what we were just talking about. So the announcement follows repeated pledges by Health Secretary Robert Kennedy Jr. to loosen regulations in peptides, which are often pitched as a quick way to build muscle, heal injuries, or appear younger, much as Mike N4JEL mentioned, seems to be drifting around through that community of bodybuilders and people that are doing training and gym rats. And apparently there's little research behind these claims, as most peptides have not been reviewed for safety by the FDA. So apparently, Kennedy, I haven't heard it myself, but he has discussed using peptides for his own injuries. And some of the major supporters of the Make America Healthy Good movement are big proponents of them. Longevity experts, et cetera, that sell peptide formulas through their websites. And you can look that article up on CBS News, on Google, under Health Watch. Just search for FDA will consider easing restrictions on peptides. No comment from me on the veracity and accuracy. Something for you to research if you find interesting, and no comments about the individuals that are suggesting this. But microdosing and getting the facts, you can go on GoodRx, and I talked about microdosing on glucagon-like peptide GLP medications commonly used the weight loss and microdosing there, according to them, means taking much smaller doses than those approved by the FDA. Sometimes used to help save money or reduce side effects. And as I mentioned, it didn't seem to be the case in that fancy part of the country I was at. Seemed it was more the off-label use aspect. Again, smaller doses was approved by the FDA. So microdosing carries real risks, according to them, including inaccurate doses, reduced effectiveness, and other safety issues. And you think you need a lower dose, talk to your prescriber about the options. Just like here, we're just talking personal opinion. We're not giving any medical suggestions to our group of listeners. And this is something you need to discuss with your physician individually. Do we have anyone here that's familiar with microdosing that has additional information that would like to discuss that? And I'll open the mic up. Let me know on Zoom, and we'll let you have the microphone at that point. Michael, let's go ahead.
Jay,
Here we are.
with regard to
Microdosing.
microdosing,
DPL Stewart. We're going to turn the mic over to Stuart. Go ahead.
you have to always be careful when you're talking about off-label use of a drug. But with regard to microdosing, the picture on the screen shows an auto injector, which is designed to deliver a particular dose. However, certain GLP-1 medications can be obtained in an ordinary vial, and then you use a needle and syringe. The issue of inaccurate dosing with a microdose would be mitigated if you had an old-fashioned needle and syringe instead of an auto-injector. Then, if you're using it for weight loss and only for weight loss, you can weigh yourself. And if you find, for example, that half of the usual dose produces your desired weight loss, then to me, it's a no-brainer. You don't have to go higher.
Okay, thank you. So you're saying apply the minimum amount of medication necessary to accomplish the therapeutic purpose.
Exactly.
No off-label though. You mentioned the particular image, by the way, that's in the slides. That is actually a screenshot of a website. So it's not one that we chose to use. The person that did the the publishing did. And Stuart, there's the oral medications now too. So those are coming on the market. And that would be another way, I guess, of microdosing. But it looked like they were starting to develop some other methods of delivery. I saw one that said buccal. I assume buccal means they're going to be doing transdermal or transepithelial, in that case, transmucosal inside the cheek. But I didn't really get into the research to confirm that. But we do know there's medications that are put in the mouth, things like nitroglycerin under the tongue. There's ways for quick absorption and action in those mechanisms. That would be another. So is this a Wild West as described? I mean, is this going to be GLP mania? We mentioned the market share the next 6 years. It looked like it was going to be fourfold. So is it because of GLP-1s or going to be other uses that are derived from medical science? For ID purposes, whiskey Bravo 5 Delta, Grand Rounds, they are net, AA4FL, the microphone, or weekly net. On 20 meters, do we have any other stations that would like to check in and make comments? Make your call at this time to whiskey Bravo 5 Delta. We're very quiet on 20 meters today. Perhaps my signal isn't having the punch that it usually has. The Journal of Diabetes and Metabolism had an article that talked about exploring the side effects of the GLP-1 receptor agonists and ensuring its optimal positioning, showing the different places that might and the different effects. So you can go into that particular, the highlights in there demonstrate the metabolic efficiency by but present diverse adverse effects, and that the GI effects are common. Obstruction, perioperative aspiration of major concerns, links to gallbladder, biliary diseases, about increasing pancreatic risk, close monitoring being essential for depression and suicidal ideation during therapy. So, as we can see in retinopathy, we have the ophthalmologic NION that Dave K2M has presented an entire session on the grand rounds on. So there's other aspects. You can search for that. It's one of the NIH sites. There's a PDF, full PDF available to originating with the diabetes and metabolism journals. And I encourage those of you on 20 meters that are interested to Google search that. What about non-FDA approved peptides? Medications to treat specific conditions that physicians can prescribe them off-label to treat other conditions. So even if they're being used off-label, they have been tested. FDA-approved ones have been tested for safety in clinical trials, but not the same for numerous non-FDA approved peptides being used by athletes and people in wellness spaces, as Mike N4JL described. A vast majority of these are injected, and of course Stuart just brought that up as well, and said that many of the injectable peptides have Star Wars droid-like names with a wide range of purported benefits, and I give some examples in this particular article. So if you want to read this particular article, not that it's not a scientific publication, it's on pbs.org, NewsHour, under health, what are peptides and are they safe? Here's what to know. We certainly can search for that. So in summary, the key therapeutic areas, the largest segment being metabolic disorders, things that we're just talking about here, GLP-1s for diabetes, obesity, insulin adjunct therapies as well. Infectious disease, according to the AI, is a 10% market share. Antimicrobial peptides, called AMPs, combating drug-resistant bacteria. And it said there's 5,099 catalog with broad spectrum activity. Oncology, it says 35% of the pipeline. Peptide drug conjugates, luteinizing hormone analogs, radio-labeled peptides for targeted cancer therapy. So as Stuart was talking about that in general, the uses and creating synthetically, we're talking about targeted cancer therapy. Wouldn't it be nice to be able to target cancer therapy and individualize it rather than trusting statistics, treat cancer and having a cancer board go over and try to find the best approach based upon statistical analysis only. It's been done in years past. High growth is expected in neurology and rare disease area, neuropeptide analogs, receptor-targeted peptides for neurological conditions, plus orphan drug designations for rare diseases. There's a lot on the horizon here in the next 5 to 6 years. There's a list here on that document about the major approved peptide drugs. Some of them we've already mentioned. The ones that we are aside from diabetes and weight management, Lupron for prostate cancer, endometriosis, Sandostatin for acromegaly, carcinoid tumors, and Agrifta SV for HIV-associated lipodystrophy. So you can see there's specialized peptides being developed for specific problems, and you can expect more of the same. There's an article in the International Journal of Molecular Sciences from, let's see what the date is here. I think it's on the next page. It's recent. Let's see, we'll come there and come back. Just April of 2025, brand new article giving the abstract about peptide-based therapeutics undergoing transformative advancements driven by breakthroughs in production, modification, and analytical technologies. Just imagine now what we have with quantum computing on the horizon, the ability to look at the genome and the analysis that can be done now that couldn't be done in past years. So the increase in multi-drug resistant MDR pathogens and complexity of modern therapeutics demands agents capable of reconciling precision targeting with molecular adaptability. And challenger peptide-based pharmaceuticals are emerging as transformative solutions. And unlike conventional modalities constrained by off-target toxicity or limited druggable targets, therapeutic peptides uniquely bridge the gap between small molecules and biologics through their programmable architecture. So the multifaceted biophases. You can find that. Let's get the name. The article is Recent Advances in Discovery. It comes out of Basel, Switzerland. The chief author is Zhang, Z-H-E-N-G. And that also came up for me as a link on the NIH. So if you just search for that article, or find the link in our slides here as you go to the website Healthcare Hands. There also is a list of different medications and the actual targets that they're targeting. And the list is, it looks like about a dozen different medications. So I suggest you bring that article up because it gives the targets and indications of peptide drugs that were recently approved by the FDA. And this article, of course, was just in April of 2025. So if you're looking for some of the most current information, it would be an excellent article to check out. And again, in summary, advantages and challenges: high target specificity and potency, lower off-target toxicity versus small molecules, programmable and tunable architectures, favorable safety and immunogenicity profiles, broad therapeutic applicability, faster regulatory pathways for biologic. There's still some challenges: rapid enzymatic degradation in life, short half-life requiring frequent dosing, poor oral bioavailability. I know that's medications that have happened recently coming out for GLP-1s that are oral. High manufacturing and synthesis costs, as one can tell in the US marketplace, the cost is prohibitive for many Americans. Limited cell membrane permeability and cold chain storage requirements. There's next generation innovations on the horizon: macrolytic and bicyclic peptides, oral and buccal delivery, as we just mentioned, and buccal would be intra-oral delivery, not para-oral. AI-driven discovery, where we just talked about AI and we talked about quantum computing and genomic analysis, looking for thousands of sequences of metabolic stability and analyzing those in the lab or by computer first. Peptide drug conjugates, doing hybrids, combining peptide targeting with small molecule payloads, improving the efficacy with fewer off-target effects. Staple peptides, which are hydrocarbon stapling with the alpha helical structure, enhancing stability and cell penetration, promising for antimicrobial applications in cell-penetrating peptides. Intracellular delivery proteins of nucleic acids and drugs, multiple candidates in clinical trials. And the future outlook, we just talked about it: precision medicine, multiple agonist therapies, combining them, oral peptide revolution, AI accelerated peptides, and peptide variants. And that's the background material that I have today. Any comments from the group here on Zoom? Would anybody like to speak further? Go ahead and let's take a list here and turn the mic over to you. This is Whiskey Bravo 5 Delta. Let's go ahead and find who would like to have further discussion.
Comment?
The WA9ZP, I'll go ahead, start.
This was mentioned in the slides, but underemphasized. If you have a peptide that you swallow, not buccal, not sublingual, but if you swallow it, peptides are largely destroyed by hydrochloric acid present in everyone's stomach. So there is a lot of ways to prevent that problem, but the problem never really completely disappears. So you always have to be concerned about destruction of a peptide drug in the stomach without it ever being absorbed into the person's bloodstream.
Thank you, Stuart, WA9ZPL. So apparently the individuals that have created the companies, the oral variants must have found some way to have it pass without being destroyed, but there would probably be better solutions if it can be absorbed transmucosally, I suppose. Would you make that assumption too as well, Stuart, WA9ZPL, WB15?
Yeah, just one simple solution that goes back a number of years would be to put a coating on the oral medication that protects it from destruction by hydrochloric acid, and then have the coating such that it will disappear later in the small intestine where the pH is less acidic. But you're assuming that the coating works as designed, and that may not always be the case.
Yeah, thank you. So enteric coating is a very common use. Is that also used in the low dose aspirins?
Yeah, that's another product that has enteric coating. But in that case, if the coating fails and the aspirin is released into the stomach, the aspirin is still absorbed into the bloodstream at the expense of perhaps some stomach irritation.
Thank you. Thank you for explaining. There's a different purpose there. Any other comments from the group before we bring this session to a close? Thank you for everyone that's here. If you're listening on YouTube, on our YouTube channel, Healthcare Ham's YouTube channel, realize that this discussion, this interactive discussion, was held on shortwave radio on ham radio in the form of a roundtable discussion by Matt. We did a Zoom simulcast. If you're interested in amateur radio, certainly you can read all about that. Do a Google search for ham radio. And you're welcome to check out our website, healthcarehams.org, and contact us, and we'll be more than glad to assist you. I'll go ahead here, and next week we're going to be talking about psychedelics, and we will look forward to those of you that are interested in participating with that. Thank you for being here today.